Hi everyone, welcome back to our channel Nursing Bharske. Today we will discuss about the most important topic osteoporosis MCQ. Let's start. Osteoporosis is primarily characterized by option A increased bone formation, option B decreased bone mass and density, option C increased bone mineralization, option D deposition of calcium in the soft tissues. The answer is option B. Decrease the bone mass and density because osteoporosis causes a reduction in total bone mass and deterioration of bone structure, leading to fragile bone and higher fracture risks. So the answer is option B. Next, the most common site of osteoporosis structure in elderly women is option A femoral shaft, option B distal radius, option C vertebral column, option D neck of femur. The answer is option D, neck of femur. Postmenopausal women often experiences fracture of the femoral neck due to decreased trabecular bone density and estrogen deficiency. So the answer is option D. Next, which hormone deficiency is primarily responsible for postmenopausal osteoporosis? Option A insulin, option B estrogen, option C thyroxine, option D cortisol. The answer is option B, estrogen. Estrogen helps maintain the bone density by inhibiting bone resorption. After menopause, decrease the estrogen level and also accelerates the bone loss. So the answer is option B. Next, the gold standard diagnostic test for osteoporosis is option A X-ray of the spine, option B serum calcium estimation, option C dual energy X-ray absorptiometry DEXA, option D bone scan. The answer is option C DEXA, dual energy X-ray absorptiometry, because DEXA can measure bone mineral density BMD, bone mineral density, accurately and is the diagnostic gold standard for the osteoporosis detection. Next, the most common type of osteoporosis is option A secondary osteoporosis, option B juvenile osteoporosis, option C postmenopausal type 1 osteoporosis, option D senile osteoporosis. The answer is option C postmenopausal type 1 osteoporosis. Estrogen deficiency after menopause causes the increased bone reabsorption, leading to type 1 or postmenopausal osteoporosis. Next, the WHO defines osteoporosis based on bone mineral density as option A T-score less than -1, option B T-score less than 1 minus 1.5, option C T-score less than minus 2.5, option D T-score less than minus 3.5. The answer is option C, T-score less than minus 2.5. According to WHO, osteoporosis is defined as when the T-score 2.5 standards deviations or the more below the young adult mean BMD, bone mineral density. So the answer is option C. Next, Next, which of the following medication increases the risk of secondary osteoporosis? Option A, beta blockers. Option B, corticosteroids. Option C, proton pump inhibitors. Option D, stents. The answer is option B, corticosteroids. Long-term corticosteroid therapy suppresses bone formation and increases bone resorption, leading to secondary osteoporosis. So the answer is option B. Next, which nutrient deficiency contributes most osteoporosis? Option A, iron and folate. Option B, vitamin C. Option C, calcium and vitamin D. Option D, vitamin A. The answer is option C, calcium and vitamin D, because calcium is the vital for bone strength and vitamin D promotes its absorption. So deficiency in either increases the osteoporosis risk. Next, in osteoporosis, bone resorption is primarily mediated by option A, osteocytes. Option B, osteoclast. Option C, osteoblasts. Option D, chondrocytes. The answer is option B, osteoclast, because osteoclasts are the responsible for bone reabsorption. Their overactivity relative to osteoblasts causes the bone loss in the osteoporosis. So the answer is option B. Next, the most appropriate lifestyle modification for preventing osteoporosis is option A, reduced sunlight exposure. Option B, high caffeine intake. Option C, weight bearing exercise. Option D, smoking. The answer is option C, weight bearing exercise. Regular weight bearing and resistant exercise helps stimulate bone formation and maintain the bone density. So the answer is option C. Next, the elderly man, the major causes of osteoporosis is option A, testosterone deficiency. Option B, excess estrogen. Option C, excess growth hormone. Option D, hyperthyroidism. The answer is option A, testosterone deficiency. Testosterone supports bone remodeling. Its decline in other men increases risk of osteoporosis. When the testosterone level decreases, the risk of the osteoporosis occurs. Next, a patient with osteoporosis complains of sudden severe back pain. The likely cause is option A, intervertebral disc prolapse. Option B, vertebral compression fracture. Option C, spinal cord injury. Option D, muscle strain. The answer is option B, vertebral compression fracture. Vertebral compression fracture. Osteovertebrae are the fragile and prone to compression fractures even after minor trauma or spontaneous stress. So the answer is option B. Next, the drug alendronate fosamax acts by option A, increasing calcium absorption. Option B, inhibiting osteoclast activity. Option C, stimulating osteoblast activity. Option D, increasing parathyroid hormone levels. The answer is option B, inhibiting osteoclast activity, because alendronate or a bisphosphonate suppress the osteoclast mediated bone reabsorptions, thus increasing bone mass density. So the answer is option B. Next, which laboratory finding is the most consistent with the osteoporosis? Option A, low serum calcium. Option B, low phosphate. Option C, normal calcium and phosphate. Option D, high alkaline phosphate. The answer is option C, normal calcium and phosphate. Unlike osteomalacia, osteoporosis shows the normal calcium and phosphate levels since mineralization remains normal. Next, the nurse instructs an osteoporotic client to avoid which of the following? Option A, walking daily. Option B, smoking and alcohol. Option C, green leafy vegetables. Option D, sunlight exposure. The answer is option B, smoking and alcohol. Both smoking and alcohol accelerate bone loss and decrease the calcium absorption, worsening the osteoporosis. Next, the main goal of osteoporosis management is increase the bone length. Option B, decreases the calcium absorption. Option C, prevent the fractures and maintain the bone mass. Option D, increase the phosphorus exertion. The answer is option C, prevent the fractures and maintain the bone mass, because the primary aim of therapy is to strengthen bones, prevent the further bone loss and reduce the risk of fracture. Next, the first line drug treatment for postmenopausal osteoporosis is option A, calcitonin. Option B, bisphosphonates. Option C, teriparatide. Option D, denosumab. The answer is option B, bisphosphonates, because it inhibits the osteoclast mediated bone reabsorptions and are the first line agents in the postmenopausal osteoporosis. Next, a T-score of 1.02 minus 2.5 on DEXA scan indicates option A, osteoporosis. Option B, osteopenia. Option C, normal bone density. Option D, severe osteoporosis. The answer is option B, osteopenia, because who defines the osteopenia as a T-score between minus 1.0 and minus 2.5, indicating low bone mass but not severe enough to be called osteoporosis. Next, teriparatide recombinant PTH is used to osteoporosis to option A, suppress bone resorption. Option B, stimulate new bone formation. Option C, inhibit calcium absorption. Option D, lower serum calcium level. The answer is option B, stimulate new bone formation. Teriparatide stimulates the osteoblasts, promoting bone formation and increasing the bone density. So, next, which of the following patients is at highest risk of developing osteoporosis? Option A, 35-year-old male athlete. Option B, 45-year-old woman on long-term steroids. Option C, 22-year-old pregnant woman. Option D, 50-year-old obese man. The answer is option B, 45-year-old woman on long-term steroids, because Chronic steroid use the increased bone reabsorption, decreases the bone formation and reduces the calcium absorption, all leading to osteoporosis. Next, the nurse should advise a patient taking bisphosphonates to option A. Take the drug with milk. Option B. Lie down immediately after taking. Option C. Take it with plain water on an empty stomach. Option D. Take it at bedtime. The answer is option C. Take it with plain water on an empty stomach, because bisphosphonates must be taken with water on an empty stomach, and the patient should remain upright for the 30 minutes to prevent the esophageal irritation. So the answer is option C. Next, which of the following is not a risk factor for osteoporosis? Option A. Early menopause. Option B. High body weight. Option C. Family history of fracture. Option D. Physical inactivity. The answer is option B. High body weight, because higher body weight exerts more stress on bones, which helps maintain the bone density. Low BMI is actually a risk factor for the osteoporosis. Next, calcitonin helps in osteoporosis by stimulating osteoclast. Option B. Decreasing bone resorption. Option C. Increasing calcium absorption. Option D. Inhibiting osteoblast. The answer is option B. Decreasing bone reabsorption, because calcitonin inhibits osteoclast activity, thereby reducing bone reabsorption and slowing the progression of osteoporosis. Next, which of the following exercise is most beneficial for preventing osteoporosis? Option A. Swimming. Option B. Cycling. Option C. Walking or jogging. Option D. Stretching. The answer is option C. Walking or jogging. Weight bearing exercise is like walking, jogging or stair climbing stimulate the bone remodeling and strengthening bone tissue. Next, which vitamin increases the intestinal calcium absorption and bone mineralization? Option A. Vitamin A. Option B. Vitamin B12. Option C. Vitamin D. Option D. Vitamin K. The answer is option C. Vitamin D, because vitamin D enhances the calcium absorption from the intestine and plays a key role in the maintaining bone mineralization. Next, which biochemical marker indicates increased bone reabsorption in osteoporosis? Option A. Serum calcium. Option B. Serum phosphate. Option C. Urinary hydroxyproline. Option D. Serum alkaline phosphate. The answer is option C. Urinary hydroxyproline, because hydroxyproline is released during collagen breakdown in bone reabsorption. Elevated urinary levels suggest to increase the bone turnover. Next, the major complication of untreated severe osteoporosis is option A. Osteoarthritis. Option B. Pathological fracture. Option C. Bone infection. Option D. Joint stiffness. The answer is option B. Pathological fracture. In advanced osteoporosis, bones become the fragile and may fracture spontaneously or with the minimal trauma. So the answer is option B, pathological fracture. Next, which endocrine disorder is most commonly associated with secondary osteoporosis? Option A, hypothyroidism. Option B, hyperparathyroidism. Option C, Cushing syndrome. Option D, Addison disease. The answer is option C, Cushing syndrome, because chronic excess of cortisol as Cushing syndrome lead to decreases the bone formation and increase the reabsorption, resulting in secondary osteoporosis. Next, a postmenopausal woman asks how much daily calcium should consume to prevent the osteoporosis. The nurse replies, option A, 400 mg per day. Option B, 800 mg per day. Option C, 1000 to 1200 mg per day. Option D, 1500 mg per day. The answer is option C, 1000 to 1200 mg per day for the postmenopausal women required daily calcium along with the adequate vitamin D for bone health. Next, nurse emphasize which key points in teaching a patient with osteoporosis? Option A, increase the caffeine intake for energy. Option B, avoid sunlight exposure. Option C, stop taking calcium once symptoms improve. Option D, maintain adequate calcium, vitamin D and exercise regularly. The answer is option D, maintain adequate calcium, vitamin D and exercise regularly. Long-term management focuses on the nutrition and weight-bearing exercise to preserve bone strength and prevent the fracture. Next, thank you everyone. Please like, share and subscribe our channel.